12:49, you're watching CT Style. February is Heart Health Awareness Month.
News 8's medical reporter Jocelyn Mimenta is going to explain how to recognize the symptoms of heart valve disease.
St. Vincent's Medical Center is raising awareness for Heart Healthy Month, and today we have Dr. Robert Jumper here with us to help us understand heart valve disease and the treatments available. Thanks so much for being here, Dr. Jumper.
Thank you for having me.
Valve disease is not something that many of us know about. What exactly is it?
Well, it's usually a functional or an anatomical dysfunction with the valves in the heart, which allow blood to pass from one chamber to another. Either the valves become stuck or don't open adequately, or they regurgitate blood, which means it goes in the opposite direction of which it's intended to go.
How prevalent is this?
Well, as you get older, it becomes more and more prevalent. Once you reach your 8th or 9th decade of life, about 25 to 30% of the population will suffer from valve disease of some sort.
Is this hereditary at all?
It can be in the younger population. If you develop it in your 60s or your 70s, it can be hereditary. But most of it is just an aging process.
Interesting. And so how do you get diagnosed for this?
Well, a lot of times it's from the patients bringing forth symptomatology, which just doesn't fit their regular pattern.
Such as?
Well, as people get older, you don't get older overnight. So a lot of times people will complain about fatigue that wasn't there a year before, or shortness of breath when they go to lie down in bed at night. It's one of the hallmark symptoms of valvular heart disease. Or sudden syncope, where people pass out for unexplained reasons.
And you say don't wait to see your doctor.
No, it's very important and it's very easily diagnosed. If you have any of these symptoms or some type of pulmonary ailment that can't be explained by your lung function, or your pulmonologist is just that he doesn't understand why you're so symptomatic. A lot of times just a straightforward echocardiogram can bring forth the diagnosis of a critical valve ailment.
Let's talk about the new, less invasive treatments out there.
Yeah, so it's an interesting field, and it's just been phenomenal, the growth in the field over the last 5 to 7 years. We have procedures which can replace stenotic valves, that can repair leaking valves, that can fix surgical valves which have a leak in them. So at this point we are developing technology which just is phenomenal for this age group who had very limited access in years past to these types of procedures.
Let's talk about one specific procedure, and that's transaortic valve replacement.
Right.
What is that?
So this is a procedure which can replace the aortic valve through a small incision in the groin, where we thread a catheter up to the diseased valve and replace it with a brand new valve. Many times the people come in and they're discharged home the next day feeling markedly better, and without the discomfort or the recovery which is usually associated with a surgical procedure.
And St. Vincent's has been doing this for years now, really in the forefront of it.
We were in the beginning part of the TAVR experience, and we've really grown and have changed the way that we deliver the care so that it's less invasive, and these people have a better chance of full recovery.
What's the success rate for this?
Well, it's about 100% as far as implanting the valves.
That's excellent.
The risk would be that these people are still being exposed to a procedure, so any risk which could be associated with the procedure. These are an aging population, and they usually have some different comorbidities which are associated, like maybe some kidney disease or prior strokes. So the patients do have some risk of those during the procedure, but they're actually less than the surgical implantation.
Well, that's great to hear. Dr. Jumper, thanks so much.
Thank you very much.
And for more information, visit stvincents.org/heart.